Welcome to Meet the Problem Solvers. I'm Judy Perlman. This week, we're really focusing on the economic disruptions caused by COVID-19. And my guest today is Cecilia Wallace. She is an AmeriCorps member who is serving at Boston Healthcare for the Homeless. In her position there as a case manager, she's helping a lot of people get access to resources that they may need as they have been faced with the sudden loss of income and other disruptions. So we have a lot to do. I'm going to dive right in. Cecilia, welcome. And why don't you kick us into a conversation about access to food?
Great. Thank you so much for having me. So diving straight into food, I think the most important thing for people to know is out there is the government assistance with food, the Supplemental Nutrition Assistance Program. Lots of folks talk about it as food stamps. So some people may have already been on food stamps before this, but if you have lost income because of this crisis and you think you may now be eligible for SNAP, I'd say it's really important to get online. They have an online application and they get turned around pretty quickly, so you can get support for your groceries in that way. I would say the next sort of tier of services that is out there are more local community-based things. So your local food pantries are a really good place to start looking. So if you know of a community center in your area or sort of a trusted religious institution like a church or a mosque that you notice has maybe had pantries out there before, look into that, reach out to them and figure out what's going on. And then another really lovely resource in the food world are these really actually genuinely just so exciting mutual aid sites that have been popping up all around the country really, and there are some incredible ones here in Boston. They're neighborhood-based sites where neighbors sort of gather and can offer all sorts of support, but a really common one is people who need grocery deliveries, maybe are immunocompromised, can't be going out and really need food delivered. You can post to this mutual aid site and ask if someone can help you with that, and neighbors have been so kind about reaching out and supporting each other in that way.
Great. So the mutual aid, again, you would just, how would you reach them? You might just Google mutual aid and your community, and then probably a link would pop up. And as we talked about before, they may have a Google sheet, they may have a phone number to call. They're very, they're interested in getting people to have a connection with humans. So mutual aid is a great place to turn. And just going back to the idea of applying for supplemental nutrition assistance, if you're having a problem with dealing with a government website, it never hurts to ask a mutual aid volunteer to walk it through with you and really kind of bounce off each question with another person on the phone, helping you make sure you're answering it fully. And
totally. Call a friend, just maintain your own sanity and frustration. When something goes terribly wrong, you have someone to be there with you through the pain.
So now let's talk about income. The loss of income is very shattering and very frightening. There are some real things out there, so let it rip. What are we looking at there?
Yeah, so I think, the biggest one is unemployment benefits. It's just so important to apply if you have lost your income because of this, making sure that you're getting the benefits that you are really entitled to. So getting onto the unemployment website application, it's all online. It is a whole process, and there's a lot of sort of ambiguous questions that you might not be sure how to answer, and there's a lot of ways to answer them wrong in a way that'll sort of spit you out. There'll be a question like, were you able to work in the last week? And you might think to yourself, no, I wasn't, because there's a global pandemic. I was not able to work. My hotel closed. But actually you technically need to answer that yes, because they're trying to show that you were like willing and able to go to work, but you couldn't. And there's lots of little moments like that could give you trouble in that world. But unemployment is so important that it's really good to just persist with this and stay strong. Know that if you sort of deserve this benefit and are eligible for this benefit, that whenever a hurdle comes up that can feel like a wall, just trusting yourself and knowing that you can get this, and then reaching out for help if you need it. So to a mutual aid site, to a local, neighbor or something. And this is where we had talked about sort of using the golden question to just get you as far as you need to go. So start with whoever you can, and then ask the question sort of, can you help me with this, or do you know someone who can? And then 90% of the time there will be a yes to one of those questions, and it'll get you eventually to someone who can help.
Right. So reaching out for help, we've talked about mutual aid. We've talked about your faith community. I think another thing that we talked about was calling City Hall. People at City Hall are there with a lot of resources, and they are great at pointing you to what you actually need. So don't be afraid to call City Hall. They are there to help you as a constituent and as a resident. So also along the lines of income, we've talked a little bit about unemployment. We talked a lot about unemployment. Now talk us through the COVID-19 checks coming from the federal government.
Yeah, so the COVID-19 checks are coming out soon. There's lots of complications with them, and things are getting updated quite a lot. The general message that we're getting is that people need to have filed federal income tax, mostly just so that the government will know where to send the check. And that can be an issue for people who don't normally file federal income tax. So if you don't normally file federal income tax, then if you file this year, anytime before, I think the deadline has been extended to like mid-July, you will get the check, even if you haven't filed, on the date that they first start sending the checks out. If you can file anytime in the year, you can receive your check.
And one resource to help you with filing your taxes is the VITA program. It stands for Volunteer Income Tax Assistance. And so if you Google VITA and your community, you may really be able to get that assistance for free, remotely. So I would not hesitate to do that if you're wondering how to get your assistance. And I will just jump on to say, we wanted to do a whole section on sort of eviction prevention and mortgage and all of the issues around housing. And what we discovered in our research is that actually those programs are quite different community to community, and they seem to be changing quickly. So rather than our trying to put together a comprehensive presentation here, here's where we really urge you to call City Hall or a mutual aid volunteer to help you find out what's available to you in your community. And there are definitely funds and resources available for that. So now let's turn our attention to healthcare and medication access.
Yeah, so this was sort of the third sort of critical service we talked about. And with this, I think the most important thing to know is that if you, again, have lost income or lost your job in this crisis, you can apply to, in Massachusetts, you can apply to Mass Health if you're sort of newly eligible for it. And those phone lines, that online service, those are up and running right now. And then also if you are looking for insurance and you may not have papers, you might have a different immigration status, Mass Health Limited is out there and usually covers sort of emergency services, and very, very rightfully COVID-19 testing and treatment is being categorized as emergency services. So you can make sure to apply to Mass Health Limited, check out your options and apply to those services now. And then the other thing that we had talked about with sort of healthcare and insurance is that a good response by the sort of health world is that they're recognizing the importance of medication delivery. So a lot of pharmacies are doing free deliveries now, and a lot of insurances are starting to cover deliveries if there is a cost. So just call your pharmacy and ask them about delivering to your address.
Great. So we also talked about sort of the mutual aid as kind of a generalist source of support, but talk to us very quickly about some of the other more specialized resources that you have in mind.
Yeah, I think basically in my work at this time, my overall sense is just that it's such an important time to dive back into the communities that you're a part of. So if you are a part of any identity-based groups, or you're part of any religious groups, you're part of any sort of worker or occupation-based groups, connect with those folks. So like, for example, the Massachusetts Trans Political Coalition is this incredible organization run like by and for transgender, non-binary, gender expansive folks. And, they've put up there like a big resource list on their website that has things like, emergency grants for sort of trans folks, and it has virtual support groups, and it has, just different sort of community resources. And there's things out there like that for lots of different community organizations. I know in this area, COSECHA is doing amazing things for sort of immigration rights and people of mixed status households, or who might not have papers. There's an amazing group called Neighbors United for East Boston that's a very like hyper local sort of neighborhood group where people on a city block will be in a group chat together and can do support. So knowing that resources like that are out there and looking for whichever ones apply to you is a really, really good way to have concrete support at this pretty wild time.
Thank you very much, Cecilia. We will, in fact, put a number of resources up on our Facebook page in the days after this show airs. I really want to thank you for your time, and everyone else, stay safe, and we'll be in touch.
Thank you so much, Judy.